Hi, my name is Chris Campbell with Cragin Pike, and I'm here to present to you the new benefits that you are eligible for as a newly hired employee of UNLV Medicine. We'll take the next 20 minutes or so to go over some slides that will highlight the benefits that you can sign up for and also follow along in your benefit guide that you should have received from Human Resources. We're going to cover your eligibility for benefits. We'll go through the medical, dental, vision plans, life and disability, and other benefits that you're eligible for. And then we'll wrap it up with what you need to do to enroll. So as a newly hired employee of UNLV Benefits, you will be eligible for benefits coverage as long as you maintain your full-time employee status, which is working over 30 hours per week. Coverage for newly eligible employees begins first of the month following your date of hire, and coverage for your dependents begins on the same day. After your initial new hire enrollment, any changes that you want to make to your coverage can only be made during the open enrollment period, which is a July 1st, 2021 effective date. That is, unless you have what's called a qualifying event. Qualifying events include things like getting married, having a baby, adoption, divorce, loss of other insurance, type of things that could happen to you throughout the year. If you do have a qualifying event, let's say you get married, you want to put your new spouse on the plan. An example of loss of coverage could be that your spouse or children have their medical insurance through your spouse's job or somewhere else, and they lose that insurance for any reason. Those are qualifying events. And when you have a qualifying event, you can add your spouse or make changes to your coverage as long as you do it within 30 days of the qualifying event date. So for example, if you got married today, you'd have 30 days from today to add your new spouse to your plan. Eligible dependents includes any legally married spouse, and then children, stepchildren, or any child who's under your legal guardianship per court order, as long as they are under the age of 26. So your kids can be on your plan as long as they're under the age of 26. They do not have to be full-time college students. They don't even have to live in your house. As long as they're your kid and they're under the age of 26, they can be on your plans. Let's go ahead and talk about your medical coverage options. UNLV Medicine provides two options for medical insurance. Both are with Health Plan of Nevada and Sierra Health and Life, which is part of United Healthcare. Your first plan option is an HMO plan. Now, the HMO is going to be the least expensive of the two options when it comes to your paycheck contributions. And HMOs are really great cost-effective ways to have insurance. You just have to understand the rules that come with being part of an HMO. So for example, HMOs, when you sign up for an HMO, they're going to designate a primary care physician for you. You can also choose your own, but most of the times they designate one for you based on your zip code or someplace close to your house. Whether you choose your own or they designate one for you, it's important to know that your designated primary care physician, which could be like your internal medicine, family practice, a pediatrician for the kids, you always go to your designated primary care physician's office first for anything you need that's not an emergency or after hours. If you need to see a specialist like a cardiologist, dermatologist, gastroenterologist, for example, you must have a referral from your primary care physician under the HMO plan. So if I woke up this morning with a rash on my arm and wanted to go see a dermatologist under the HMO, I need to go see my primary care physician first, and then they'll write a referral for me to go see that dermatologist, or maybe just handle it themselves. So it's important to know you'll have that designated primary care physician. You need to get a referral to see a specialist. The other thing that's really important to understand about an HMO is that HMO plans do not cover you outside of Southern Nevada except for certain circumstances. So for regular care, if I just wanted to see a doctor while I was in San Diego, I'm not going to be able to go see a doctor under the HMO plan because it's not covering me outside of Southern Nevada. Now, there are a few exceptions to that rule. Life-threatening emergencies. So if I was, say, down in San Diego, on vacation, I had a heart attack or I broke my leg, I got hit by a car, something like that, I would be able to go to the hospital, go to the emergency room, and they do have coverage in those circumstances. Another option for accessing care outside of the normal service area is through telemedicine. We have a program called Now Clinic, which I will talk about in more detail shortly. And under Now Clinic, you do have access to medical care virtually through your phone or telephone or your laptop, regardless of where you're located. And then third, HMOs will cover your prescriptions when you're out of the service area. So again, if I was in San Diego on vacation and I needed some antibiotics, or maybe I forgot my pills at home, I need an emergency refill, you can go to the pharmacy and get those prescriptions filled, even though you're outside of Southern Nevada. So for the most part, I mean, 9 times out of 10, you're probably going to access care here in Southern Nevada anyway. And while the HMO is not designed to cover you outside of Southern Nevada, it does have some very good options that will allow you to access care if you need to. Now, this particular HMO plan with Health Plan Nevada, you'll see, I'll go through these benefits. These are also in the benefit guide that you should have received from Human Resources. So everything that I'm going to talk to you about today, you'll find in that guide. It does have an annual deductible of $1,000 per person. Now, the deductibles run on a calendar year, so they reset on January 1st each year. But the important thing about the deductibles, I don't want them to scare you, the deductibles do not apply to most of the everyday things you're going to use your health insurance for. So things like doctor's office visits, lab, x-ray, urgent care, prescriptions, things like that. The deductible does not apply. You would not have to meet the deductible in those circumstances. The deductible is reserved for the big ticket items, things like hospitalizations, surgeries, things like that. You'll see an out-of-pocket maximum. It says $6,250 per person. What this is your worst case scenario for all of your co-pays, your out-of-pocket expenses. It's really designed to help protect you in case something catastrophic were to happen. So for example, if I had open heart surgery or I was diagnosed with cancer and I was constantly in and out of the hospital and having surgeries, et cetera, and I'm paying co-pays at the doctor, the hospital, the pharmacy, at some point, if I ever hit $6,250, I don't have to pay any more co-pays for the rest of the year. So I've met my maximum. Everything else for me is free for the rest of that year. So it's still a lot of money, but it is some light at the end of the tunnel. You know, you're not going to have unlimited medical bills. You know, you don't have to worry about losing your house or your car or anything like that along the way. You'll see under the HMO plan, it's a $25 copay to go to your primary care doctor. That includes pediatricians and OBGYNs. If you do need to see a specialist with a referral, you'll pay $50 for that. Lab work, x-rays, you can see the copays here, $15, $25. Complex imaging like CAT scans, MRIs is a $100 copay. A nice thing about the plans is preventive care is covered at 100%. So you can go get your annual physical, wellness exams, well baby checkups, pap smears, mammographies, colonoscopies, flu shots. As long as they're preventive in nature and your doctor codes them as preventive, they're covered at 100%. Urgent care visits are $30. So if your PCP is not available, if it's on the weekends or after hours and you do need to see a doctor and it's not a life-threatening emergency, really recommend using the urgent care facilities. There are Southwest Medical Associates urgent cares all over the valley. There's even a 24/7 location on the corner of Rancho and Charleston, right by the Smith's grocery store there, that is very accessible. So definitely consider using urgent care after hours, and it's a $30 copay. If you do need to go to the hospital emergency room, it's a $400 copay per visit. So definitely cost effective to use urgent care when you can. If you do go to the hospital and you have to be admitted overnight, it's a $400 copay after your deductible. And it says up to a $1,200 max. So what that means is after you've paid your $1,000 deductible, you'll pay $400 per day for the first 3 days only. So if you're there for 3 days, you'd pay $1,200 copays. If you were there for 8 days, you would still just pay the $1,200. You only have to pay for the first 3 days. If you do have to have outpatient surgery, so like it's one of those surgeries where you go in the morning and you come home the same day, it's a $275 copay per surgery after your deductible, including the surgeon, the anesthesiologist, the facility, everything. So those are your medical benefits under the HMO plan. The next plan you have access to is a PPO plan. So the PPO plan is a little bit more expensive when it comes to your paycheck contributions, but it has some distinct advantages. So those rules that I just told you about on the last slide with HMOs, where you have to go to your designated primary care physician, you have to get a referral before you can see a specialist. HMOs don't cover you outside of Southern Nevada. Those rules don't apply here. With the PPO plan, you have the flexibility and access to a lot more doctors than you would under the HMO plan. So with this PPO plan, and like I mentioned, you don't need referrals. It's United Healthcare's national network of doctors and hospitals. So if I wanted to see a doctor in San Diego, I could look them up onto the United Healthcare website and go see a doctor in San Diego and pay a copay, just like if I was in Las Vegas. So it definitely gives you that ultimate flexibility to see the doctors that you want to see. It also has out-of-network coverage. So that means if you went to see a doctor or maybe went to a hospital that was not listed as contracted provider on the United Healthcare website, there is some coverage for that, but you subject yourself to balance billing and other overage costs that out-of-network doctors can provide you. So you definitely want to stay in network. It's super important that you always check, make sure the doctors you're going to are in the network before you do that. With this PPO plan, you can see it has an annual deductible, calendar year deductible of $1,500 per person. Just like on the HMO, the deductible does not apply to the big ticket stuff. So hospitalizations, surgeries, MRIs, that's where you're worried about the deductible. But things like office visits, prescriptions, lab, x-rays, the deductible is not something you're gonna have to concern yourself with. Out-of-pocket maximum, so just like on the HMO, the PPO has an out-of-pocket maximum. It's $4,500 per person, so quite a bit lower than the out-of-pocket maximum on the HMO plan. You can see here listed the copays for office visits, labs, x-rays. We won't go through all that. You can read it and pretty understandable. When you do get to things like imaging, inpatient hospital, outpatient facility, it says your cost is 20% after deductible. So 20% is called a co-insurance. And all that means is after you've met your $1,500 deductible for the calendar year, then the insurance company is going to pay 80% and you're going to pay 20%. Now the 20% you pay is 20% of the insurance company's discounted rate, not the actual bill. So if you went to the hospital for 4 days and the bill was $50,000, but their contracted rate was $10,000, you're going to owe 20% of $10,000. You would not owe 20% of $50,000. So that's why going in network and getting access to those discounts is vitally important to saving as much money as you can when you're accessing care. Prescription coverage is the same for both plans. So on the prescription plan, you've got coverage for retail prescriptions, which is what most people do. Most people go into the pharmacy like CVS, Walgreens, and they pick up their prescription, they walk out with it for 30-day supply. So you can see here the copays listed for that. 9 times out of 10, you're going to get a generic prescription written by your doctor. You can see that's a $10 copay for generic, or what they call tier 1 medications. Tier 2 or brand name medications are $35 copay. And then tier 3, which includes non-formulary and also specialty medications, are a $60 copay for a 30-day supply, for up to a 30-day supply, I should say. And that includes some of the really expensive medications. There are medications out there that I've seen that cost $25,000, $30,000 a month. And in that case, UNLV Medicine and the insurance plan is paying the vast majority of the costs for all of those. Below retail, you'll see mail order prescriptions. This is a really nice way to get your prescriptions if you're on a maintenance medication. So you think of things like high cholesterol, blood pressure, diabetes, things like that. Something you take every single day as a maintenance medication. You can get a 3-month supply for a 2.5-month copay. So you get to save a little bit of money, and those prescriptions get delivered straight to your house. So it can be a convenient way to get those maintenance medications. Whether you're on the HMO or the PPO plan, all local hospitals are currently contracted with your insurance. So If you had to go to the emergency room or your doctor did want to schedule a procedure, you're going to have a baby, just know that any of the hospitals around town are currently available to you on both plans. I had mentioned when I talked about the HMO plans, Now Clinic, and whether you're on the HMO or the PPO plan, Now Clinic is a really great program that gives you 24/7 access to doctors via like a Skype, kind of a Zoom meeting, if you will. Um, right from your home, you could be traveling in your hotel room, you could be in your office, anywhere you might be, as long as you have access to a phone or a cell phone, you can use Now Clinic. And so with that, you can have a virtual visit with a physician right over your phone. They can help diagnose what's happening, what's going on. If you need a prescription, they can electronically submit your prescription to the pharmacy of your choice. So it's just a really great and convenient way to have access to a doctor for, kind of the not so serious medical conditions. You can see some examples here: allergies, cough, cold, flu, headaches, things like that. The best part too about Now Clinic is it's absolutely free. So $0 copay when you use the Now Clinic. And it's easy to do. You just download the app and get yourself registered. All the instructions for Now Clinic are in the benefit guide that you were given. We have two really great wellness programs that are included with your health insurance. The first program is called Real Appeal. It's a medically supervised weight loss program that once you sign up for, they put you together with a health coach. You do weekly check-ins with your health coach to try and meet your weight loss goals. The really nice thing too is when you first sign up, one of the first things they do is they mail you this really big box full of supplies to help you meet your weight loss goals. And you can kind of see a little bit of a picture there on the screen with things like a food scale, a person scale, some exercise information booklets, cookbooks, things like that will help you get along the way. And once you've been enrolled and met some of your goals about 5 weeks into the program, they send you a second box, which has like a Ninja type blender in it that, you can make smoothies and things like that to, again, help you on your path to weight loss. The other program to tell you about is called Rally Health. And Rally Health is an online program where you can register and set goals for yourself. You'll answer questions. It'll kind of give you a rally age. So, you might be 40 years old but your rally age could be 35. It could be 45, depending on your current health. But it sets goals for you. And as you accomplish those goals and take certain actions to improve your health, you can register those on the website and you start to earn rally coins. And once your bank of rally coins builds up, you can redeem it for really cool gifts and things like that. So Rally Health, again, free, doesn't cost you anything to be part of the program. Let's move on to dental and vision coverage. So we have a dental plan, again, through United Healthcare. It's a PPO dental plan. So that means you can go to any dentist you want. Ideally, you would go to somebody who's contracted or in network, because that's where you're going to get the best benefits. You can see the maximum benefit per year is $1,500 per person, plus what's called dental rewards. So what that means is you, your spouse, your kids, each one of you get your own bucket of $1,500 a year to spend on dental care. And that number can actually increase over time through the dental rewards program. And the way that works is, as long as you go to your dentist at least once a year let's say for your cleaning, and your total dental claims for the year are less than $750, they will take $500 of your maximum benefit and roll it over into next year. So that means next year, instead of having $1,500, you'd have $2,000 in your bank. And you can do that every single year until it hits a maximum of $3,000. That's where they cap it off at. But it incentivizes you to go get your cleaning once or twice a year. And then if you ever really did need something serious, you've got that bank of money built up for when the time comes. You'll see preventive services like exams, cleanings. Most of your x-rays are covered at 100%. So there's no out-of-pocket cost for you when you go do that. Basic services like fillings, anesthesia, root canals, oral surgeries, the plan picks up 90% of the cost. So you only have to pay 10% of the discounted rate after you meet your $25 annual deductible. Major services like crowns, bridges, dentures, the plan will pay 60% and you pay 40% after your deductible. And then finally, the plan does cover orthodontia for children. So it covers braces, 50% of the cost up to a $1,500 lifetime maximum per child. One thing we do recommend is if you go to the dentist and they're going to do anything that's not preventive, that you just get a pre-treatment estimate. So this is just like if you went and got your car fixed by a mechanic, you would get a written estimate for getting your car fixed. We think you should get a written estimate for getting your teeth fixed, because we have seen dentists try and bill some pretty outrageous rates to people. And so just having a good understanding of exactly what the dentist is going to do for you, what your insurance will pay and what they won't pay, I think is really important. So just get that pre-treatment estimate from your dentist. Doesn't cost you anything. A lot of dentists already do it automatically anyway, but it's a good idea to ask for that so you don't have any surprises on the back end. We have a vision plan with United Healthcare. So through the United Healthcare Vision Plan, you get an eye exam once every 12 months. You get glasses or contact lenses, one or the other, every 12 months. And you get new frames for your glasses every 12 months. There's no deductible. Your eye exam is covered 100% after a $10 copay. And then when you go to get your glasses or contacts, you pay a $25 copay, and then you have a $150 allowance for your contacts or frames. So if you want contact lenses, you get $150 of as many contacts of your brand of contacts you can get for $150. That's what they're going to give you. If you choose glasses, you can pick any frame in the store you want. If it's $150 or less, it's free. If you want $300 Armani frames, you can have them. You get $150 credit towards those, and then a discount off of the difference. Let's wrap it up with some other benefits that you have access to. You do have an employee assistance program through Mutual of Omaha. This EAP provides free access to telephone counselors and therapists for things like alcohol, drug, gambling addiction, depression, family counseling, other types of issues. It's available 24/7. There's no copays. There's no out-of-pocket costs. If speaking on the phone with somebody isn't doing the trick and you feel like you really need you or maybe a family member needs to sit down face-to-face with a therapist, you get up to 3 face-to-face counseling sessions per year at no charge. Everything about the EAP is 100% confidential, so no information ever comes back to UNLV Medicine or my office or anywhere else about who's seeing the program for what. So you know you can use the program in confidence because of that. UNLV Medicine does provide you with company-paid life insurance, so all full-time employees receive this. Even if you decline medical, dental, vision, everything else, you're automatically going to get this life insurance. The coverage is 1.5 times your annual pay, up to a maximum benefit of $150,000, plus an additional 1.5 times your annual pay for an accidental death. So in the case of an accidental death, it could be up to 3 times your annual pay. So that's provided to you at no cost by UNLV Medicine. You do have the option to purchase additional life insurance through paycheck deduction. The rates are really inexpensive. When you do go online to enroll, you'll get to that screen. You can just move the button back and forth and it'll tell you how much life insurance you can buy and at what rate. As a new hire, if you're considering extra life insurance, now is the time to do it because you do have what's called guaranteed issue, where you can get a significant amount of life insurance with no medical questions asked, and the details of that are in the benefit guide. UNLV Medicine also provides you with company-paid long-term disability. This is paycheck insurance. You know, if you got hurt or sick and, you know, we're not able to work for an extended period of time. So let's say, you know, I got in a car accident, really got hurt really bad. Maybe I might not be able to work ever again. That's what long-term disability is for. So the way that it works is after 180 days of a qualified disability, so roughly 6 months, the LTD policy covers 60% of your salary up to a maximum benefit of $10,000 per month. And as long as you continue to qualify for long-term disability benefits, they'll pay you every single month all the way up to age 65. So it's a really great benefit. The fact that UNLV Medicine pays for this is phenomenal. Provides a lot of long-term security, you know, for people who might be, you know, in the worst situation possible. We have other voluntary benefits. These are things that you would pay for out of your paycheck if you want it. The first one's kind of really important, short-term disability. So I just mentioned how UNLV Medicine gives you long-term disability, but it takes 6 months for that to kick in. Short-term disability bridges the gap there. And with short-term disability, after 7 days of a qualified disability, the policy kicks in and can cover up to 60% of your salary, up to a maximum benefit of $1,500 per week. And they'll send you a check every single week for up to 6 months, as long as you are out on that qualified disability. The next three are accident, critical illness, hospital indemnity. There's really good details of these in your benefit guide. These are supplemental benefits. So what they're designed to do is layer on top of your medical insurance. So let's say accident, for example. Let's say my kid falls off his bike and breaks his arm, right? We have health insurance. We can go to the emergency room, but the HMO copay is $400 to go to the emergency room. Well, if I have this accident plan, I can submit my claim to the accident, to Mutual of Omaha, to the accident policy, and they're going to send me a check to help cover either most or all of my copays towards these accidental injuries. So this helps bridge the gap on those copays, out-of-pocket expenses. Critical illness works the same way. It could be cancer, heart attack, stroke. There's a whole list of covered critical illnesses where they will help pay you on top of what the medical insurance covers. Same thing with hospital indemnity. If you do end up spending the night in the hospital for most reasons, pretty much any reason, the hospital indemnity plan is going to help cover your out-of-pocket expenses, specifically to hospital stays. So just review the policies. Just like anything else, there's really great coverage. There also are some exclusions, so make sure you understand that before you sign up. You can definitely call our office if you have any questions about those. Finally, the last benefit, flexible spending accounts. So these are a really great way to cover out-of-pocket expenses for healthcare and for dependent care. The first one is the healthcare flexible spending account. It lets you pay for certain IRS-approved healthcare expenses with pre-tax dollars. So the money comes out of your paycheck on a pre-tax basis, goes into a savings account that you own, and then you can use that money, at the pharmacy, the dentist, the doctor's office, the eye doctor, wherever anything that's IRS qualified. And there's about 8 pages of things that are qualified. So pretty easy to spend the money if you're motivated to do so. The annual maximum amount that you can contribute to your healthcare FSA is $2,750 a year. Now keep in mind, whatever money you put into your healthcare FSA, you have to spend it in that calendar year. Anything you don't spend, you risk forfeiting back to the plan. Now you can roll over up to $500 of unused funds in your account every year. So if you have $500 or less left over, no problem, it's going to roll over to the next year. But if you had like $800 in your account, you can roll over $500, but you're going to lose the other $300 because you didn't spend it. So you just want to be smart about it. If you're healthy and you don't spend any money at the doctors for the most part, you probably don't want to put any money into a healthcare FSA. But if maybe your kid's going to get braces, you want some new glasses this year, maybe you're on a prescription that you're going to spend $10 a month on, that's $120 a year. You can put that money into a FSA and save some money on your taxes, and it's a really great way to cover those costs. Dependent care FSA, if you got kids in daycare or preschool, this is like a no-brainer. And then you can set aside up to $5,000 per calendar year and use it to pay for child or adult dependent care if you are the legal guardian of an adult. But you can use that to pay for those child care expenses. Keep in mind, whatever you put in the plan, you have to use it in that same year, and there is no rollover. So if you don't spend it, you're going to lose it. So you want to, again, be smart about it. The other important note about FSAs is the FSA open enrollment runs on a January 1st calendar year. So all the other benefits I've talked to you about so far run from July 1st to June 30th. The FSA is the only plan that runs on an actual calendar year basis. So you will see more information about FSA open enrollment, usually around November, if you want to participate in the FSA. Keep in mind too that it runs on a calendar year. So if you're enrolling towards the end of the year or mid-year, you want to calculate how much you're going to spend just for the remaining months of the year that we're in. Paycheck contributions, these are all in your book, so I'm not going to spend too much time going over each one. You can see what they cost per pay period. I will mention you can make independent elections for your coverage. So maybe you want to do employee only for medical, but you want to do employee plus children for dental and vision, or maybe you don't even want the vision, you just want dental, you just want medical. Each benefit is independent, and you can make those elections however you want. How to enroll, there's complete instructions in your benefit guide to access the online system. You go to the website listed here, mybenefitsenroll.com. You use the company code UNLV Med, and it takes you right through. It's really important that you double check the information that's already preloaded in the system, things like your address, dates of birth, etc., because whatever's in the system is what's going to get forwarded to the insurance companies. And a lot of problems happen if like birthdays are wrong, social securities are wrong, things like that. So everything should look good in the system, but please just double check it when you do that. As you're going through your enrollment, if you have run into any problems, you can call the benefits team here at Cragin Pike at the number listed. The numbers are also in the benefit guide that you received. Give us a call anytime. We're happy to help walk you through that. Or if you just have really any other questions about any of your plans, that's what we're here for. Cragin Pike, we work for you guys. We don't work for the insurance company. So we're here to help you. We have benefit advocates on our team that can help you with maybe, say, medical bills that you receive in the mail that you're not sure whether you should pay or not. Maybe you're having problems getting a prescription or a surgery prior authorized by the insurance company. These are all the types of things that Cragin Pike can help you with. So feel free to give us a call. Again, our contact information is in the benefit guide as well. That's it. I want to thank you for paying attention and going through this presentation with me. And if you have any questions, please call us here at Cragin Pike. Thanks.